Mary Limone. I'm an advanced nurse practitioner, and I work for Morristown Hospital, Atlantic Medical Group. So an advanced nurse practitioner is a nurse, a registered nurse who goes on to their master's program to get more advanced training. So we have the ability to treat, diagnose, and prescribe medication. You can find them in all walks of life. So you can see them in corporate, you can see them on cruise ships, you can see them in hospital, office practice, ORs, pretty much anywhere. Typically we see patients. I'm an outpatient practice, so I generally see up to 20 patients a day. We have front staff. I work with 4 other physicians. We have phlebotomists. So we do well visits, sick visits, annual exams. I only see adults, but my colleagues, some of them do see kids as well. Physicians, phlebotomists, front staff, certified medical assistants are typically in our office. I was in college. I was a nursing assistant for a couple of years, so that helped. When I went to Rutgers for undergrad, so that helped to kind of get my foot in the door for a job and to get some experience with other nurses. So pretty much I did that before I graduated. My mom was a nurse for 40 plus years. I have a lot of people in my family that were nurses or physicians or some type in the medical field. So I would just see my mom go to work. She had the old school white hat, and just seeing how she was so committed to her job just intrigued me in helping people. Went to Rutgers. I did my bachelor's there for 4 years. I worked in the city as an RN. Then I went to another job and decided to be a nurse practitioner. So I went for my master's. It was UMD&J, now it's Rutgers. So I worked full time and I did grad school at the same time for about 3 years. So Morristown is a huge hospital, Atlantic Health System. AMG is the office practice group, so they're pretty extensive. But you can work in any populations, corporate, small office, anywhere. Basically, that's the ability of what's great about nursing is the flexibility of working different roles, different positions, flexibility with childcare, hours. So it's good, pretty positive, yeah. So pros and cons. Pros are basically you have the whole, organization that helps in terms of just the overhead, like office administration things, dealing with all the paperwork, really negative. It's not really a negative. It's, I came from a small office to Atlantic Health. So, smaller was nice because it was just us, it was a smaller group, just one doctor and myself. But there's pros and cons, but in both ways, they're both beneficial. You have to be a registered nurse, have your bachelor's, you have at least 1 or 2 years of experience, and then master's full-time is 3 years. And then if you want to do any specialty, you can do an additional year or 2. But now they have programs. There's a doctor nurse practitioner, and that's the doctorate, and now they can combine that with your master's at the same time. I go by hourly because I'm just part-time, but generally you can be salary. Flexibility. So I work 2 days a week, so I'm able to see patients, leave, get my kids from school, and then I'm done. And then I can just work from home, check lab work, call patients if they have messages. So it's been really positive in that way that flexibility is there. So I can still have childcare and still be with the kids. Taking care of people, seeing them, doing preventive care, seeing them take control of their health, seeing patients that were borderline diabetic, becoming healthy, fit, decreasing the risk for heart disease, high cholesterol, making patients realize how much what they're doing is impacting their future with their family. So it's nice to see improvement. Current events, COVID-19 completely new. That's been going on for the past 3 months. So it's definitely challenging because it's still the unknown in terms of treatment, what to teach the patients, explaining to patients about the future. So there's times I've been a nurse practitioner for 17 years. So this is the most challenging because there is no answer. There is no answer yet. Sometimes you can get emotionally attached. I've worked in cardiology, I've worked in oncology, having the connection with the patients and seeing something go through with their family and them personally. Sometimes you get attached, and that can be difficult. So when I was a child and I saw my mom in the white hat. I'm like, what are you doing, Mom? Where are you going? And she explained to me what she did. Seeing her, knowing what she did, telling me stories of how she took care of patients. She worked in the ICU since she was 22. And just, just seeing how people feel better and just educating. So I worked for 17 years. So basically I've had backgrounds as a nurse practitioner in cardiology, in the ER, ICU. I worked in the city, and now I work, because I have 2 kids now, so now I work just office practice. Definitely reach out to local nurse practitioners in your town, calling local schools or programs that offer the nurse practitioner program. Shadowing a nurse practitioner is really good. I've had students from high school and college when they're kind of still trying to figure out what they wanted to do, because some people don't know what I am. When I started this career, I worked in Manalapan, New Jersey, and patients were like, what do you do? And it was great teaching them, because they're like, what's that? Are you a nurse? Are you a nursing assistant? I'm like, so it was good educating, and there are some people that still don't know what I do. So it's nice to have high school students say, hey, you know what? Can I shadow you for a day? What do you do? What is your role? So, which is nice, which is helpful. Definitely going to basic, like American Academy, nurse practitioners. Those are the groups that certify us. You can do just web search about what nurse practitioners do, and even calling the local hospital, the education department, and they'll be willing to give you someone to kind of explain everything and tell you kind of the best resources to learn. But definitely web search is the